you don't understand health insurance, you are absolutely not alone. It is the majority of people. And in fact, I spend a lot of time training healthcare professionals, and they don't know this information either. No one knows about this. So my name is Joanna, and I am the CEO of Triage Cancer, and I am a cancer rights attorney. So I've spent the better part of my legal career teaching people how to navigate systems that come up as a result of a cancer diagnosis. And about 11 years ago, I co-founded an organization called Triage Cancer, which is a national nonprofit organization that provides free information and education on all of the legal and practical issues that come up as a result of a cancer diagnosis. But many of those things are things that you wouldn't think of as legal issues, like how to get health insurance or what to do when an insurance company denies coverage for your care, or how to take time off work or access government benefits. But all of those things are actually rooted in the law. And we want people to understand their rights under the law so you can effectively navigate those systems. So today I want to just give you some of the tips and tricks that we have learned over the years to help navigate insurance. But just so you know, there is a lot of information that we have available on a variety of different topics, so you don't have to learn it all today. We have a lot of resources on our website at triagecancer.org in lots of different formats. So everything from animated videos to longer guides to a podcast. So you can find information however you want to consume it on our website. We also host free educational events throughout the year, and you can sign up for those events that are held both in person and online. So in the cancer community, we spend a lot of time talking about the cost of cancer care. And about 10 years ago, there was this term used called financial toxicity, which really speaks to the burden that a cancer diagnosis can bring in terms of your finances. The reason we haven't solved that 10 years later is because there's lots of contributors to financial toxicity. So it might be the high cost of care, but it might be because you have to take time off work, and so you stop having income coming in. So all of these things together really have a huge impact. But the thing that we think has the greatest impact at Triage Cancer is having adequate health insurance coverage and then knowing how to use it effectively. So being able to navigate that system. And those are the things that I want to talk about today. So unfortunately, in the United States, there isn't a class on health insurance in high school. We just have to sort of figure it out as we go along. And unfortunately, about 96% of people in America cannot actually define the 4 key terms used in health insurance coverage. And so if you feel like you don't understand health insurance, you are absolutely not alone. It is the majority of people. And in fact, I spend a lot of time training healthcare professionals, and they don't know this information either. So it's not surprising that only 40% of Americans felt like very confident that they could pick a health insurance plan. I would say they're probably overconfident if they don't know those 4 key terms. We spend a whole lot of time making purchasing decisions when we're planning a trip or buying a car or even a computer or a new phone. We spend 15 minutes or less picking a health insurance plan. So mostly because we really don't know what are the key factors to compare when picking a plan. And we're going to talk about that. So those 4 key terms are what I want to start with. When we buy a health insurance policy, we typically pay for it through a monthly premium. But then there are costs that we pay when we actually use our health insurance and get medical care. And the first is our annual deductible. It's what we have to pay out of pocket first before our health insurance kicks in. And then there's something called a copayment, which is a fixed dollar amount that we have to pay when we go and get certain types of care. So a $10 copayment to a primary care physician, a $50 copayment to see a specialist. And that's different than coinsurance or cost share. Those are 2 terms that mean the same thing. And it's the difference between what insurance companies pay for our medical expenses and what we pay. So if we have an 80-20 cost share, insurance pays 80% and we're responsible for 20%. But the most important thing that anyone should know about their health insurance policy is their out-of-pocket maximum. because in a worst case scenario, that's the most you're paying out of pocket for your medical care during the year. So it's a fixed dollar amount that you can wrap your head around to know that's the most. And the way that you get there is that you get to add up what you pay for your deductible and your co-payments and any co-insurance amounts that you pay to help you reach the out-of-pocket maximum. And when you do, then your insurance kicks in at 100% for the rest of the year. So to give you an example of how this works, Dan has a plan that has a $2,000 deductible, and it's an 80-20 plan with an $8,000 out-of-pocket maximum. So he spends a week in the hospital, and he walks out with a $102,000 hospital bill. Assuming he's had no other medical expenses during the year, how much does he actually have to pay of that bill? Any ideas? It's $8,000 because that's his out-of-pocket maximum. But this is how you get there. So first he pays his $2,000 deductible, which leaves $100,000 left of that bill. And then his insurance is going to pay 80%, and he's responsible for 20%, which leaves $20,000. How much does he actually have to pay of the $20,000? $6,000, because he has the $8,000 out-of-pocket maximum. He's paid $2,000 towards his deductible, so he only spends another $6,000 to reach the out-of-pocket maximum. Now, I'm not saying $8,000 isn't a lot of money, but at least it's a dollar amount where you stop having to pay. And we actually have this exercise in one of our animated videos. So if you know people who you think could benefit from this information, you could share that. But the devil is always in the details when we talk about the law. So you need to understand how the out-of-pocket maximum works for your specific plan. If you have a marketplace plan, it requires the deductible, the co-payments, and the co-insurance amounts for both medical care and for prescription drugs to all be included in the out-of-pocket maximum. So it's the most protective. But employer plans carve things out. So some employer plans say, oh, we're only going to look at co-pays and co-insurance. You have to pay your deductible plus your out-of-pocket maximum. Or they say, we're only going to look at co-insurance. Or they say, we're going to have separate out-of-pocket maximums for medical care and prescription drugs. So you need to understand how your plan works so you know what that maximum amount is going to be for your particular plan. The other important term that I want to mention about health insurance is that in-network versus out-of-network is an important thing to understand when shopping for health insurance coverage. Insurance companies contract with providers. So they literally sign a contract with your doctor to say, we're going to work with you and we're going to pay you when you provide care. Those are in-network providers. Providers that don't contract with your insurance company are out-of-network providers. And your insurance company might not pay for any care that you get from those providers. So that's something extra that you're going to have to pay out of pocket for. So when you're shopping for insurance, you have to remember to look to see, are your providers in that insurance company's network? There are also some terms related to prescription drugs. The formulary is the list of drugs covered by a particular plan. So the same thing, when you go to shop for a plan, you want to make sure that your prescription drugs are actually included in that formulary. And the formulary is broken up into different payment levels called tiers. And this is just a sample of what a tier could look like, where at tier 1 for the cheapest generic drugs, you'd maybe only pay $5. So for an antibiotic, maybe you'd only pay a $5 copayment. And then there's tier 2 with more expensive generic drugs and maybe some preferred brand name drugs, where then you'd pay $25 in a copayment to pick it up at the pharmacy. And then tier 3 would be more expensive and non-preferred brand name drugs, where you'd pay a $100 copayment. But tier 4 is where you find specialty drugs and drugs that have just been approved by the Food and Drug Administration. And there you're not paying a copayment, you're paying a co-insurance amount. So it's a percentage of the cost of the drug. And unfortunately, we see most cancer drugs showing up under this tier 4 specialty level, where you're paying maybe 20% of a $10,000 a month drug. So that's considerably more than a $5 copayment at the pharmacy. So when you're looking at insurance plans, understanding how the payment tiers work are also going to be something you want to pay attention to, so you know what you might have to pay out of pocket for your drugs. Now, in the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, or we're getting it through the government. And by that, I mean Medicare, Medicaid, military and VA health, state or local programs. But still about 50% of people in the United States get their health insurance coverage through an employer. Now, out of curiosity, so I know who's in the room, how many of you have an employer plan? And how many of you have an individual or marketplace plan?
It's very easy. Is that considered right?
It's actually usually considered an employer plan. And then Medicare, Medicaid? Anything I missed?
What about the one share managed?
Is that a healthcare sharing ministry? So that's actually not insurance. So a lot of the consumer protections that exist in health insurance actually don't apply to healthcare sharing ministries, because effectively what it is a group of people who've gotten together to say, if you have medical bills, we'll pay for those medical bills. Over time, companies have gotten into the mix, and they are selling healthcare sharing ministries. And the way that they're marketing them is very confusing for consumers, because it makes it feel like it's insurance and you're paying a monthly premium into it, but it is actually not a guarantee that they will pay for the care. And so we've seen across the country, some states, the insurance agencies suing those companies because their selling practices are deceptive and they aren't paying the bills. So there are pros and cons to them. And, I've had some people tell me I have one and it's great. And then I've had people tell me that they've had challenges paying their bills, but it's actually not insurance. Yes.
I think we said employer, but the government.
Yes. So it's the federal employee health benefits plan, and it's an employer plan. But they have a whole separate set of rules that apply to those plans. But the consumer protections that I'm going to mention are included. So we really feel strongly, because having adequate insurance is the number one contributor to financial toxicity, that you know all of your health insurance options. Because we kind of think, oh, my employer's giving me a plan, I'm going to take it. But sometimes it's not a great plan. Sometimes it's got a high deductible or a high out-of-pocket maximum, or it doesn't cover your providers. And so you're getting something, but it isn't actually what you need. And so knowing what all of your health insurance options are can actually help you make better educated decisions. Even if you have, one that kind of is at the top of the list, it's good to know what they all are so you can compare them. So we have a lot of resources at Triage Cancer to help you understand your options. And I just want to give you an example. So Ross and Rachel Geller are married, and in July, Rachel decided to take time off work to deal with her cancer treatment and recovery. And she used to have health insurance through her employer, but when she told her employer she was leaving, her employer gave her paperwork to elect COBRA coverage. COBRA would cost Rachel $800 a month. Ross has insurance through his employer that costs him $300 a month. Adding Rachel to Ross's policy would make the monthly premium go up to $500 a month. Rachel's worried because she has surgery scheduled in August. How many options for health insurance, or comprehensive health insurance options, does Rachel have? Any ideas? Types of health insurance could she get? Most people can come up with 3, but she actually has 4. So she could take COBRA through her employer and keep her employer's plan. She could move to Ross's employer's plan, assuming there was a special enrollment period through the employer where she could move to the employer plan. She could qualify for what else? Well, disability would give her money. Disability insurance is about money, but not health insurance. Was there another answer? Who said 3? What was the third option you came up with? Marketplace. She could go look to see if she was eligible or could get a marketplace plan that would cover her care. Any others that you can come up with?
In California, there's the California.
Yes. So Medi-Cal could be an option, but based on I didn't sort of read it, but based on the income level of their household, they wouldn't actually qualify for Medi-Cal in California.
She's 10, but
So she could actually look to see if she could get on her parents' plan, if her parent had a plan that was available to her. She can. So even if she's married, she can still be on her parents' health insurance plan. It's just based on age, but it would only cover her until she turned 26. So we'd want to know a little more information about, does she turn 26 before her surgery in August and when that would be? And then she'd still have to think about her options at that point. But she does actually have 4 options. So in thinking through the cost and doing the math to compare all those options and what it would cost her, it's good to actually know all of them so you know where to start from. So as I mentioned, we do have a lot of resources to help you understand your health insurance options as well as navigating health insurance. And you can find that on our website at triagecancer.org/health insurance. So we happen to be in the fall at the moment, and it is open enrollment for different types of health insurance. So there's open enrollment for Medicare going on right now. Medi-Cal or Medicaid applications can be accepted year-round. If an employer plan restarts in January, open enrollment is often in the fall. And then Marketplace open enrollment starts November 1st and goes until January 15th. In California, it goes until the 31st for the covered California Marketplace. So it's a good time of year to sort of be looking at your insurance options and making sure that your plans still work best for you. And I want to walk you through an exercise on how you actually compare your health insurance options. And you can use it if you're comparing Marketplace plans, if your employer gives you more than one choice, like through the Federal Employee Health Benefits Plan. You can use this exercise. You can compare what your employer gives you to the Marketplace. You can also compare Medicare Advantage plans using this exercise. So here are 3 plans. There's a bronze plan at $200 a month with an $8,000 out-of-pocket maximum, a silver plan at $275 a month with a $6,000 out-of-pocket maximum, and a platinum plan at $400 a month with a $2,000 out-of-pocket maximum. So assuming you are going to hit your out-of-pocket maximum, because when we're talking about cancer care, it's pretty likely, can you tell just by looking at them which is going to cost you the least by the end of the year? No, you can't. You have to do the math first. But if you did the math in your head fast, I'm impressed. So the way that you do the math is you take the monthly premium and you multiply it by 12 because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum because that's the most that you're going to pay out of pocket for your medical expenses during the year. So that will tell you your total cost for the year. And in this case, you're right, it is the platinum level plan, and it ends up saving you more than $3,000 by the end of the year. So when we talk about how do you mitigate financial toxicity and having adequate health insurance coverage is the number one way to do that, this is what we mean. But the math is never the same. Like it's never always the platinum plan or always the bronze plan. You actually have to look at whatever options you're looking at and do the math to see which one is the best. But it isn't just math that you have to look at. You have to make sure that the providers and the facilities that you go to are covered by the plan and that the prescription drugs are actually covered by the plan. So what I just explained is actually also in an animated video. And then we have worksheets to help you actually do the math. So if you want to print these out from our website, you can actually use the worksheet to compare the different plans that you're looking at to do the math to see which plan is going to work best for you. We also have worksheets available for Medicare. So if anyone you know is looking at Medicare options, those can be used too. So then once you have insurance, are there ways to actually lower your costs? And the answer depends on what type of insurance that you have. So for example, if you're eligible for COBRA and you're concerned about that high monthly premium, there is actually a program, and it does exist in California, called the Health Insurance Premium Payment Program, where if your income level does qualify you for Medi-Cal, instead of actually getting your care paid for by Medi-Cal, the state will actually pay your COBRA premiums for you because it's cheaper for the state just to pay your monthly premium. than it is to pay for all of your care through the Medi-Cal program. So this is actually one of those things that I call as a good kept secret of our healthcare system. We do have information on our state resources page for where you go to sign up for this program in California. Now, if you're looking at the marketplace for options, since the marketplace opened in 2014, at different times, plans have cost different things. And a lot of people looked at the marketplace and said, well, that's too expensive for me, or the plan choices at that time didn't work for me. But it changes every single year. So it's always worth taking a look just to see what's available to you specifically in the marketplace. And this is what it looks like based on income level. So in California, if you have a household income up to 138% of the federal poverty level, you have access to Medi-Cal. But if you're between 138 and 250%, you can buy a marketplace plan and you'll get financial assistance called premium tax credits to lower what you pay for your monthly premium based on your income level. And then the cost-sharing subsidies provide reducements of your copays and your deductibles and your co-insurance funds. And then if you're between 250 and 400%, you have access just to the premium tax credit. So all of this to say is basically if you have a family for making under $111,000 a year, you're getting some type of financial assistance to buy a plan in the marketplace, which I don't think most people realize. And then with the Inflation Reduction Act, we got some additional financial assistance in the marketplace where if you have a household income between 138 and 150%, 4 out of 5 people can find a plan in the marketplace for $10 or less per month. So that's pretty significant if you're paying $10 a month for health insurance coverage. So I point this out because a lot of people aren't aware of this financial assistance because if you qualify, this could be a pretty useful way to get health insurance. It also added help at the higher income level of the spectrum because you might have a higher income level, but the cost to actually buy health insurance might be a very large portion of that income. So basically, they added financial assistance to lower what you pay each month so that it's not more than 8.5% of your household income. So unfortunately, though, this financial assistance actually only goes through the end of 2025 because the financial assistance was part of a COVID package to provide financial help for people who are struggling. So it will sunset at the end of 2025, and we don't know what will happen by then. For someone who has, no one mentioned that you have Medicare, right? Okay. I do just want to mention in case you have family members, there are different financial assistance programs in Medicare based on household income that pick up some of those out-of-pocket costs for Part A and Part B. And then there's also one for prescription drug costs in Medicare. And if you want more information on these, that you can find on our website as well. I mentioned that having adequate health insurance was number one in terms of lowering financial toxicity, but knowing how to use your insurance effectively is really number two. And I want to focus on appeals. It is not uncommon for an insurance company to deny coverage for something at some point, whether it's a prescription drug or surgery or treatment. And unfortunately, as a society, we take no for an answer when it comes to health insurance coverage, but you have the right to appeal any denials. And for people who have private insurance, like through an employer or an individual plan, you have an internal appeal, which means you can go back to the insurance company and say, can you look at this again? And if they still say no, you get to go outside the insurance company to an external or independent medical review, where you're going to an independent entity to say, is the care that I've been prescribed medically necessary? Clearly, your healthcare team is prescribing it for a reason. They think it's medically necessary. So if that entity says, yes, it is, that decision is binding on the insurance company. California does that through the California Department of Managed Healthcare. It's a very consumer-focused entity. And also through the Department of Insurance. So that's a great resource. And 60% of the time in California, the external appeals are successful for patients. The problem is when I say no one knows about this. No one knows about this. So this is just data from Marketplace Plans nationally in 2021, where 48 million claims were denied, and 0.1% of those denials were appealed, just to the first level of appeal inside the insurance company. So when you think about 48 million claims being denied, if they had gone to external appeal, about 50% of them would have been successful. So that's 24 million claims, which are 24 million people who would have gotten access to the care that they were prescribed by their healthcare team. What this also means is that people aren't getting access to care because they can't afford to pay for it out of pocket, or they're paying for it out of pocket, which is contributing to that financial toxicity. So this is a big soapbox issue for me because this makes me crazy. This is horrible that many claims are being denied, and then people don't know that they can question that they don't have to take no for an answer.
And that's a boost on I didn't do anything like doctor.
Many healthcare providers will do this for patients, but some won't. And ultimately, providers don't know this information. So I speak at a lot of provider conferences, and I will tell you, they have no idea that the external appeals process exists. They'll help a patient up through the internal appeals process, and then they stop at that point if there's still a denial because they don't know about external appeals. So this is also why it's a soapbox issue for us, because we want patients and providers to know this exists to make sure patients are getting access to the care that they need. So to that end, we have a lot of resources to help with the appeals process, also depending on the type of health insurance that you have. So the external appeals is specific to private insurance, but there is also obviously Medicare and Medi-Cal, and military plans. So understanding the appeals process for each of those types of coverage is something that we explain on our website. So turning to medical bills, we definitely don't recommend this strategy for dealing with medical bills. Avoidance coping is not helpful because you might miss out on some opportunities. The problem is it generates a lot of paper, and it might be actually physical paper, like you're getting it mailed to you. It might be in an insurance company's portal. It might get emailed to you, but the communications become challenging, and they're usually not very clear. But you might get a communication from your insurance company that says, "We've received a claim from your provider." There's nothing you need to do with that. They're just letting you know. Then they might send you a letter saying, "We're now processing that claim." Still don't need to do anything. But then you might get another letter that is an explanation of benefits. And it usually looks something like this, where you have your contact information and a summary of the claim and a chart and codes and numbers that might not have any explanation. But then it tells you what the insurance company did with that claim. And then it tells you what you're responsible for. And a really good EOB at the bottom here on the left will also keep track of whether or not you've met your deductible and your out-of-pocket maximum. Although I always recommend keeping track on your own to make sure that what they have in their records matches your own records. But the key piece of information on an EOB is that it says this is not a bill. You do not pay your EOB. It's just a notification from your insurance company how they handled the claim from your provider. But it's important to pay attention to because there could be mistakes in that EOB. And you want to make sure that what you have as what you think the care that you received matches up to the EOB. About 40% of all medical bills actually have errors in them. So you want to pay attention to these. The last piece of paper that you are going to get related to a medical bill is the actual bill from the provider. And you don't want to pay that bill until you get the explanation of benefits from your insurance company, because you want to make sure that they match. And sometimes the challenge of this process is that all of those communications don't arrive in order. So you might get the EOB before you get the letter saying we're processing your claim, which is kind of confusing. Or you might get the bill before you ever get the first communication from your insurance company. And I will tell you from personal experience, in the past, I had an annual checkup and I got a bill from my provider for $1,000. And then I had a heart attack. And then I realized that an annual visit should have been $0. And it was just that the provider sent the bill before they ever got any communication from the insurance company. But if I had paid that bill first, then I'd be in the position of having to track down that money from the provider and get it back. So it's important to make sure that you don't pay the bills until you get the EOBs and make sure that they match, that they're correct. If you have any questions, you can talk both to the provider and to the insurance company. And if the result is that the insurance company has denied coverage for something, so on that EOB, they're saying they're paying $0, that's also an opportunity for you to engage in the appeals process. I will also mention that there is something called charity care, which I don't know is the best term for it, but nonprofit hospitals in the United States are required to provide financial assistance to patients based on their income level. And it's generally referred to as charity care. Even if you've received a medical bill that you are having trouble paying, it's worth checking to see if you qualify for that hospital's financial assistance program. And there is an organization, which is a fantastic resource called $4, and they will do this for you. So you can send them your bill and they will check the hospital that you received care at and your income level and see if you meet their requirements, and they'll actually communicate with the hospital for you to get the hospital to negotiate down that medical bill. So it's a very useful resource just to check. You don't know until you try. The other thing that some people aren't aware of is if you have a medical bill that you are struggling to pay, you could actually negotiate with your provider. So especially if it's a larger hospital, they already have a system set up for this. It's not an uncommon thing for patients to ask for. So you might be able to ask for a discount on the bill. We might be able to ask for a payment plan. Maybe if you have a $1,000 bill and you can pay $700 of it, you can offer them a lump sum payment for a write-off of the rest. So sometimes they're more willing to do that than to accept a payment plan because they might not ever get that money in a payment plan, whereas a lump sum payment, it's sort of money in their hands and they're more willing to accept that. The point is that, again, if you don't ask for it, it's unlikely to be offered enough. So you have to know it's something you proactively ask for. We do have a resource at Triage Cancer that we refer to as our medical bill tracker. So it's a spreadsheet that you can download from our website, and you can keep track of your medical bills. And this is just a zoomed in version of the top. But you can put in your insurance company information, what your deductible is and what your out-of-pocket maximum is. And as you put in the medical bills that you've paid, it keeps track for you of what is left to meet your deductible and what is left to meet your out-of-pocket maximum. So it's already programmed. It's got formulas in it to do that math for you. So it's just a good way for you to keep track of what you've paid for and make sure your insurance company also has the same information. The other way it's useful is that your providers don't always know that you've met your out-of-pocket maximums. So when you go into the doctor's office and they ask you for a copayment, you might have already met your out-of-pocket maximum and don't have to pay that copayment. But if you don't know that, again, that's something that you have to track down and get refunded from your doctor's office. So if you're keeping track and know you've already hit it, you can say to the provider's office, I've already met my out-of-pocket maximum. I don't owe a copayment, but if you're concerned about it, you can bill me after the fact. And then they can just get the information from the insurance company that you've already met your out-of-pocket maximum, and then it's not a problem. The other reason why is that it might save you some money to keep track of those medical expenses because they are tax deductible. So keeping track of all the things that you've paid related to your medical care and dental care, even if it's mileage or transportation, or hotels or lodging or meals related to traveling to treatment, all of those things could potentially be tax deductible for you if you itemize your taxes. So it's a good way to just keep track of that information in that spreadsheet. The last thing I want to mention related to health insurance terms is that the news is not a useful source of information on health insurance. And the reason why is they use terms interchangeably that often don't mean the same thing. And surprise billing and balance billing is a good example of this. So surprise billing is when you know you have to have surgery. You pick a surgeon, you pick a hospital to have surgery at that is in network for your insurance company. Then you get home and you get a bill from the anesthesiologist for $5,000 because it turns out that anesthesiologist was out of network. It was a completely surprise to you to find that out, which is why it's referred to as surprise billing. Over the years, states have been passing laws to protect patients from surprise billing, but in most states, it's focused on emergency room care because we usually can't control where we're going to for an emergency. So it might be out of network. Balance billing is where you know you're going to an out-of-network provider, and you go to that provider and that provider charges you $100 for that service. And you have a plan that pays 50% if you go to an out-of-network provider. So the provider charges you $100, the insurance company pays $50, and you have a balance of $50. Because that provider is out of network, that provider can charge you the $50 balance of that bill. So that's balance billing. If the provider were in network, the provider would not be allowed to balance bill you. It would be illegal. So if the provider charged you $100 and the allowed amount that they agreed to receive from the insurance company is $70, they can't bill you for the $30 balance of that bill because they're an in-network provider. So that balance billing and surprise billing is not exactly the same thing. There is now a federal law that went into effect January 1st of 2022 called the No Surprises Act, which protects patients from surprise billing for emergency room care, but also non-emergency room care. It is incredibly useful to patients so that your provider has to treat that surprise anesthesiologist as if it were in network and pay for that provider as if they were in network. The only thing that this loops out is ground ambulances, which is a huge problem. California just passed a law to protect patients from surprise billing and ground ambulances, which actually goes into effect next year. So what's important to know about the No Surprises Act is that if you have a surprise bill and you're struggling to deal with it with your insurance company and the provider, there's actually the No Surprises Help Desk. So you can go to the Department of Health and Human Services and call or submit your bill online, and they will handle it in negotiating between the insurance company and the provider to resolve the surprise bill. But basically what it means is it's no longer the patient's problem to deal with the surprise bill. So the last thing I want to mention is financial assistance. And a lot of times in the cancer community, when someone is talking about the cost of care and struggling to pay for the cost of care, everybody jumps to financial assistance, which is important. But we also want to make sure that whatever is causing the underlying need for financial assistance gets addressed too. And if it's because someone has an inadequate health insurance plan, or they need to be able to stay at work and their employer isn't letting them, or they don't know that they qualify for disability insurance, we want to make sure that people get access to all of those resources as well. But there are financial assistance options available beyond just paying for health insurance. And at Triage Cancer, we collect that information on our Cancer Finances Toolkit. So if you go to the toolkit at cancerfinances.org, we have financial assistance, and these are just some examples of programs. We also have information on how to lower costs for prescription drugs, so private programs as well as pharmaceutical company programs. And we actually have a chart of every company that makes a cancer-related drug and the contact information for their financial assistance program. So that is available on the site. And then we have a lot of educational events as well. We do have a live webinar series that occurs monthly. And I left this information on the side just so you know the last couple of topics that we did, because in September we did a program on Medicare, and in October we did one on getting ready for open enrollment, which does a deeper dive into health insurance than there is time for today, but we record all of our webinars. So you can go and take a look and watch them at your convenience on our website as well. And then we know that people still have questions after going to events and reading information online. So we have our free legal and financial navigation program where people can contact us with their individual questions. So any of the issues we've talked about today, as well as many others, the fastest way to get a hold of us is to actually fill out the form at triagecancer.org/get-help. And then it automatically sends you an email to schedule an appointment with my team. You can also absolutely call us as well. This just avoids some of the phone tag that occurs. Questions?
I have a question for you. A lot of these patients that are here have been on cancer treatment for 2 years. At what point are they eligible for Medicare, and if that would benefit them?
Yes. So there are two primary ways to qualify for Medicare. Either you're 65 years and older and eligible for Social Security retirement benefits, or you've been receiving Social Security disability insurance, SSDI, for 2 full years. So after you've been receiving the cash benefits of SSDI, then you become eligible for Medicare. Please don't ask me why, because it makes no sense that there's that kind of waiting period. And there's been a bill in Congress for the last few sessions to try to eliminate that waiting period, but that is currently the way that you can access, the way that you can access Medicare through SSDI. The SSDI application process, well, let me ask you this. How many people are actually on SSDI or some other type of disability?
On Medicaid.
So state disability insurance, SSDI, a private short or long-term disability policy.
Is that the same thing as Medicaid?
No. So Medicaid and Medicare are health insurance programs. SSI and SSDI are the 2 federal long-term disability programs. So disability insurance by itself has nothing to do with health insurance. It is solely providing you cash and replacing your wages because you have a medical condition that is keeping you from being able to work. In California, I'm just assuming everybody's from California. Are there other states in the room? Montana, Colorado. Okay. So I'm sorry. There's very little available in Texas. Sorry. Colorado has a few more options. But there are only 5 states and Puerto Rico that provide a state disability insurance program. So it's a short-term disability plan that lasts up to a year. So it's California, New York, New Jersey, Rhode Island, and Hawaii that provide that program. Then you can also get a private short or long-term disability policy that you either bought from an insurance company or you get through an employer. And most people get it through an employer because we just don't buy disability insurance in the United States. Those programs also are replacing wages that you would have had if you were working. The Supplemental Security Income, which is SSI, and Social Security Disability Insurance, which is SSDI, are the 2 federal long-term disability programs. It has the highest standard of disability in all the laws and programs that we talk about because they expect you to have a medical condition that lasts at least a year or longer, and that medical condition keeps you from being able to do your current job, but really any job that you've had for the last 15 years. So it's a very high standard that you have to meet, but you can. So you have to show, really, that you have a medical condition and that it's keeping you from working because that's what they care about. So you have to make sure that you're documenting the side effects that you're experiencing in your medical records and making sure you're reporting that to your healthcare team so that it gets documented so that when you apply, you're more likely to be approved. But the application process has challenges in that it can take a long time and 65% of applications get denied the first time around. So you also have to pursue the appeals process there, and you're much more likely to get access to your benefits. We have a lot of resources on disability insurance, both the different options and then also tips for navigating the application and the appeals process, and then once you have it. But there's a timeline involved. So, well, first let me explain. SSI is for individuals who have a low income and low resource level, which is tied to Medicaid, or in California, Medi-Cal. So the income level, you have to have a very low income level, and the resource level, which is your assets, if you have more than $2,000 in savings as an individual, you will not qualify for SSI. And what you get paid each month is about $950 each month from SSI. That's the highest amount that you get paid. SSDI is not based on your income level. It's based on your work history, and that you've paid into the Social Security retirement system over your work history. So it's like getting access to your retirement benefits early because you have a disability and aren't able to work. The maximum amount that you can get paid from SSDI is about $3,500. It goes up every year, so it's about to change again. If you are Bill Gates and make $10 million a year, you're still only getting about $3,500 a month. It's capped at that each month, in the same way that retirement benefits are capped as well. Once you've been receiving those cash benefits from SSDI for 2 years, then you become eligible for Medicare for health insurance options. SSI is tied to Medicaid. SSDI is tied to Medicare. We actually have an hour-long webinar on disability insurance if you want more information on disability insurance. So that's a recorded webinar on our website. Were there any specific questions that people had about disability insurance or other things?
So I've always worked in California minus a couple of years. And with my previous employers, I didn't have to think about paying for short-term disability. It was always automatic. When I became a government employee in 2015,
We stopped paying into SSDI.
I stopped paying. I didn't even know, right? So when this happened, my doctors wanted to put me on short-term disability, but I didn't have that insurance available. Is there anything that I can do besides buying it separately, or is that what I have to do?
So it's not likely you can buy a private disability insurance policy once you have a pre-existing medical condition, because they will make you go through medical underwriting. So the pre-existing condition protections that exist in health insurance don't apply to disability or life insurance. So it's very hard to buy once you have a medical condition. If you're a federal employee, so just for everybody in the room, if you're a federal employee, you don't pay into the California State Disability Insurance payroll taxes, and so then you can't draw on that money. So besides getting a job in California and paying into the system a minimum amount to be able to draw on it, there's really not an option for short-term disability insurance. That said, it doesn't hurt to try. I mean, you could still look to see if there's an insurance company that sells policies in California that would be willing to give you a plan.
This is just information. When I was single and I was working at the hospital, I bought private insurance. So I was a mere 21-year-old, and it covered my pregnancy. So I was paid for 7 months by this private insurance. And then and I was a caregiver for our daughter who had cancer, I had a lot of anxiety. My blood pressure went up. So I was able to tap into that private insurance until I turned 65 in June. And a friend of mine said that, how did you get the private disability insurance? And I said, well, I purchased it. And through all these years, I paid for it. So she had cancer at the same time as my daughter. She was able to get private disability. She only paid 9 months, like a premium of $500 a month. And she got, when she passed away, her beneficiary was her sister. And she was able to get it even with a pre-existing cancer. And she had ovarian cancer.
Do you know what company it was?
You know what? I have to find out from a friend, because she was just inquiring how I was able to get my private disability insurance, and I was not 65 then. And I said, well, I purchased this a long time ago. And when she Googled something, she was able to do that. She did not have to go through all the process of getting your lab works, as long as she had, I think she was able to get she was able to get a letter that she does have cancer.
So
So I don't know. I will find out, and I will tell Aki which insurance that is. But it's something like she was able to get $300,000 when she passed away, given to her sister, who was a beneficiary of that private insurance. Yeah.
Lied here, just get out of me.
unfortunately, it's like a quarter-based system, so you have to have earned and paid in at least $300 in payroll taxes in order to start drawing on the system. So if it's been, more than a year, basically you haven't paid in recently to be able to draw on it. Yes. I'm sorry, I didn't hear you. Yeah.
You talked about SSDI and then the Medicare.
Yes.
Is there a window that closes to apply for Medicare after SSDI?
No. So once you've been receiving SSDI for 2 years, you automatically become eligible for Medicare. So you will get notification that you are eligible for Medicare. But then at that point, you have to make some decisions on how you want to access your Medicare, because there's different ways to get Medicare coverage.
Flag here. You do.
Yes. So there's something called the initial enrollment penalty, or the initial enrollment period, which if you are turning 65 for Medicare is the 3 months before you turn 65, the month you turn 65, and 3 months after. There is a similar window when you become eligible for Medicare because of SSDI. If you don't sign up for Medicare Part B and Medicare Part D, which is the prescription drug coverage, at that point, you do face late enrollment penalties. If you have to pay late enrollment penalties, those actually reset when you turn 65 and you have a new opportunity because you're newly eligible for Medicare because of your age as opposed to disability. And we have a lot. If you are considering making Medicare decisions, I would definitely recommend the webinar we just hosted on Medicare.
So in regards to SSDI, is there any exceptions or way around the rule that a certain amount of credits have to be earned within the last 3 to 5 years?
No. It's actually 5 years.
5 years.
So in the same way that we were talking about short-term disability in California, for SSDI, you have to have paid into the Social Security retirement system 5 of the last 10 years.
Yeah.
And there is
Yeah, and so that's why I was digging online. I did research and stuff. So I would ask.
You were saying that you could qualify for, if you prove that you are not able to work for, is it 2 years you said?
for SSDI, it's a year.
Oh.
Your medical condition has to last at least a year or longer.
Okay. Is there like a part, like I'm only able to work, 20 hours a week or something like that? Is there something?
For SSDI specifically, they are very focused on you not being able to work.
Okay.
Whereas some private insurance companies will actually reimburse you if you need to reduce your hours.
Okay.
So they basically balance out your salary rate. But SSDI doesn't do that.
Okay. Thank you.
Once you have SSDI, there is a process to help people return to work where you can have a balance between benefits and trying to go back to work, but not when you first apply.
Additional information on SSDI. She's very good at researching. She said that there is a website in the Social Security, all the comorbidities that you have to qualify you for that SSDI. And what she did was she showed the doctor the qualifications on how you can get the SSDI, and her doctor documented everything that she has, which mimic the same qualifications. And she was denied twice. The third time, she hired an SSDI lawyer, and it went through. And I have another friend who said that I was denied 5 times. So having a Social Security disability lawyer would really be helpful.
So it depends. You absolutely do not need one when you apply. But I would say that if I were going to an SSDI appeals hearing with an administrative law judge, then I would hire an SSDI appeals attorney. This is not the moment you hire your neighbor tax attorney, because the SSDI appeals attorney works with those judges and vocational experts every single day. That is literally all they do, is sit in a room and talk to each other. And the hearing is unlike any other television courtroom drama that you've ever seen. It is the judge and you, the person you brought to represent you. If you brought someone, it is not required. And it's the judge who asks the questions. So the judge is asking you things about how your medical condition impacts your ability to work. So how long can you sit? How long can you stand? How much can you lift? And it's the judge's decision. So there's no jury or anything like that. It's the judge who decides whether or not you have a medical condition that is impacting your ability to work. And those judges, even though they're attorneys and judges, they have a huge amount of medical knowledge. I've been very impressed with the SSDI administrative law judges and what they know. It is very important, as I mentioned earlier, that you don't underreport your side effects and that you are talking to your healthcare team about what you are experiencing so that it is documented in your medical records, because all of that information goes to Social Security. It can also be helpful to talk to your healthcare team that you are applying, and if there's any additional information that they can include in a letter, even along with your medical records, to help reinforce your qualification for disability benefits. The medical conditions are public information. It is on the website. But just documenting side effects is not enough in your application. What you need to communicate is that you have these side effects and this is how it's impacting your ability to work, because that's what they care about. So you can have a whole bunch of side effects and still work, but they want to see how it's impacting your ability to work. So that's how you kind of have to frame it for them.
Any more questions? Anybody? Oh, geez. Hold on a minute.
So I just have a question on private insurance through like an employer.
Yes.
So part of the reason why I decided if I ever had a reoccurrence or anything ever came back, I would work until I died, is because of the option of private insurance through an employer. In your opinion, or in what you've seen in the past, typically the questions that they ask when you're signing up for private insurance through an employer, life insurance, short-term disability, they don't ask the questions like, have you ever had an existing pre-existing condition? Would that be something, if available to people, to go and get a job with the private employer that does, or with an employer that does offer private insurance, just so we maybe have a back way around getting life insurance?
No. So there's two parts to that. There's health insurance, which anyone with private insurance, employer or otherwise, has access to the pre-existing condition protections. Then we're talking about disability insurance that you can get through an employer or potentially a life insurance policy. With life insurance, they are still going to look to see, they're going to ask you underwriting questions in the application, even if you're part of a group through the employer. Or wait, let me just finish. So they're going to ask you those questions. It's up to them to decide how they want to insure you or not. But most of those policies have written into them, if something happens to you within 2 years, they will not pay out. So you have to look at the fine print. And then on the disability insurance side, they usually do have pre-existing condition exclusions. So if you were hit by a car, they would pay out. But if you were to die of a pre-existing condition, they wouldn't. So you have to look very carefully at the policy. So just being an employer plan by itself doesn't necessarily mean you get access.
So I do have a question as far as the employer plan goes, because I know, for example, my employer, there's a multiplier for life insurance that I automatically qualify for working there. But the moment that I try to up that multiplier, let's just say times 7, then I have to fill out the underwriting of conditions as shows that pre-existing condition. If hindsight, I were to keep it forever just at that three multiplier, just because I know, would that be a way, or have you seen them still deny a life insurance policy at that point.
No, if you didn't have a pre-existing condition when you first got it and you qualify for the plan, they wouldn't deny you just because you have a pre-existing condition now. So it depends. You do have to look very carefully at the policy language for any type of insurance when we're not talking about health insurance, because the regulations or lack of regulations are much more significant. So you have to really pay attention. There, with life insurance, it's a little bit easier than the disability insurance to get a private policy because there are a lot of plans that you can go with by, I don't want to name any specifically, but like you see them on television, of where there's no medical underwriting and they'll pay like a small amount of life insurance. But even those policies still have those clauses. If you die within the first 2 years of the policy, they'll either not pay out at all or they'll only refund you the amount of the premiums you've paid to date.
My last question, I promise. I had short-term and long-term disability when I was diagnosed. And I was covered for almost 2 years until I decided to go back to work. Does my pre-existing condition allow me to still continue? Because I still pay for the long-term and short-term disability to this day. So
because it's the same plan, and that's actually the benefit to disability insurance. Like, they don't want you to be on disability insurance. They want you to go back to work. But if you were to need to come back to the disability benefits, you could do that because it's the same continuous policy.